Stem cells are the starting point for the tissues of your body. Your body grows them all the time. So male researchers thought, why not put them working to damage tissue like heart muscle and bone? Here's an example that's really hip from Dennis Duda for the Mayo Clinic News Network.
Mayo Clinic orthopedic surgeon Dr. Rafael Sierra is glad he can help this patient walk again by replacing her badly damaged hip joint. But he'd rather help patients avoid such surgery entirely. She's only 19 years old. Harsh rounds of chemotherapy helped her beat cancer, but caused a condition called osteonecrosis.
Essentially the death of the bone.
It can happen in knee, ankle, or shoulder joints, but most commonly occurs in the hip at the top of the femur or thigh bone. 80 to 95% of patients eventually need artificial joint replacement. However, injections of stem cells have healed the hips of some of Dr. Sierra's patients with a minimally invasive 45-minute outpatient procedure that poses very little risk. First, 2 small cuts are made at the top of the hip bones.
We harvest the bone marrow from the iliac crest from the patients, and it's currently put into a centrifuge where we spin down the cells.
The stem cells are then mixed with platelet-rich plasma from the patient's own blood. Next, the doctor does a hip decompression, the standard procedure of opening the diseased bone at the top of the femur to release pressure and allow new bone to grow.
Now allows us, through a special instrumentation system that we've actually designed here, is to inject these cells into the area of the necrosis.
Director of the Mayo Clinic Center for Regenerative Medicine, Dr. Andre Terzic, says this is just one tantalizing example of how helping the body heal itself can lead to actual cures.
In other words, we have been able to go after the symptoms of disease. Increasingly, with the advances in technology, we'll be able to go after the root cause of the problem.
Dr. Sierra says for most of his patients, stem cell therapy means their hip replacement can wait, hopefully indefinitely.
In 80% of the patients, we have been able to halt the progression at least at between 2 and 5 years.
For the Mayo Clinic News Network, I'm Dennis Doda.
Besides chemotherapy, there are several conditions and medications that can destroy healthy joints. For example, steroids given for organ transplants. It's thought this process could also be used to help bone fractures heal. Male researchers also are using them to repair heart muscle for heart attack survivors.
And now a recap of the headlines. The National Disaster Management Council meets on the territory's state of preparedness for the hurricane season. The tourism industry received training on how to respond to the global media in times of a crisis. The Premier addresses the territory on the direction of the financial services industry, stating that the government is working in a new environment where the goalpost is constantly moving. Police Traffic Department says cell phone traffic violations have gone up significantly this year. The number of turtles nesting on BVI beaches has declined, and officials appeal to the public not to disturb turtles while nesting. Students at the Enid Scatliff Pre-Primary make healthy choices with fruit and water at snack time, and dazzling dance performances at this year's Dance Fest. In news from the Caribbean, a new British visa rules is set to be tearing families apart, and Turks and Caicos Islands begins construction on a new terminal at the Providenciales International Airport. Remember to visit jtvlive.net for more news, JTV's television programs, and events now playing on JTV. You can also watch this entire newscast on jtvlive.net. We welcome your questions and comments. You can email us at jtvnews@hotmail.com. I'm Ino Soman. Thank you for watching.
Wardrobe provided by Umi Fashions.